Very good morning, dear students. I'm Khushi Malviya, Professor Siptec, College, Gandhinagar. In today's class, we are going to study the subject Social and Preventive Pharmacy, 8th semester, and the topic we have taken for today's class is from Unit First, that is concept of health and disease. We will talk about the health and the disease. Mainly, we have to focus first on the concept of the health. Health, what is health? It is health that is real wealth and not pieces of gold and silver. That is said by the Mahatma Gandhi, the father of nation. Definition of health. There are many definitions for the health. The World Health Organization, that is WHO, defines health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. WHO 1947. This definition was given by WHO in 1947. Next, the health is a broad term individualized to each person and is affected by so many factors. Thus, it has various definitions as already I have told you. Disease. Disease is a pathological change in structure and or functions like the signs. What are the signs that describe the disease? Then illness. We talk about the illness. What is illness? Illness is the response of person to disease. What the person responds to the disease, that is illness, which is based on the person's perception. Means illness is according to the perception. What a person perceive, that is illness. Means symptoms. Symptom decide the perception of the human or the person. Next is wellness. Health is a status in which individual is capable of meeting the minimum physical, physiological and social requirements of appropriate functioning. Wellness means it is a status in which individual is capable of meeting the minimum physical and physiological or the social requirements that decides the wellness. This is that this we have discussed about the health, disease, illness and wellness. Now, what are the concepts of health? Three concepts of the health are there. Physical environment, example like air, water, soil, housing, etc. We can call biological environment also. Then disease in a community may be compared with an iceberg. According to this, health is a fundamental human right like physical dimension, mental dimension and social dimension. Now, if you would talk about the concept of health education, what is the concept of health education? Health education is a profession of educating people about health. Means health education by name it is clear that we are educating it is a profession in which the people's education is for educating the people about the health. Health education can be defined as a principle by which individuals and the group of people learn to behave in a manner conducive to the promotion, to the maintenance or restoration of the health. This is the concept of the health education. Now we talk about the concept of public health. Public health. Public health is defined as the science of protecting the safety and improving the health of communities through education, policy making, and research for disease and injury prevention. The definition of public health is different for every person. Okay, get it? What is public health? Science of protecting the safety and improving the health of the communities from for about how it improve by educating, by policy making and research for the disease or the injury and for working on its prevention. That is the public health. The definition of public health is different for every person. Now, if we talk about the branches of public health, what are the branches of public health? Biostatics and informatics, community health, epidemiology, environmental health, global health, health policy and management, health promotion and communication, maternal and child health. These all are the branches of public health. Now, if you talk about the what is the mission of the public health? So, the mission of the Department of Public Health and Preventive Medicine is to improve the health of the communities we serve, including rural, underserved, and global population through education, same as we have discussed earlier, and research, outreach, service, and creative partnerships. This is the mission of the public health. Now, the main objectives of public health, same it is like the mission in main objective of public health, what it do? The public health aims to improve the quality of life through prevention and treatment of disease, including mental health, and then this is done through the surveillance of the cases and health indicators. It is obvious that how it will prevent and give the treatment by the when we surveillance the cases and what are the cases in our society or in community we are having. So it is very mandatory to surveillance of the cases and health indicators, and it is through the promotion of the health behaviors. Okay students, this is all about today's class. Thank you. Have a nice day.